You may have had a recent PSA test and your doctor may have told you, hey, your PSA is a little elevated, it's about 4.0. And you came home and started Googling it and you found all these things that could be wrong with you, from prostatitis to cancer. So in this video, we're going to talk about what you should really know when you hear that your PSA is 4.0. Should you be worried or not? Let's talk about it. Hi, I'm a urologist and pelvic surgeon, and if you're new here, I make urologic content every Monday and Friday. So make sure, if you like what you see, share this with your friends. So first off, what is a PSA and what is it for? Well, the American Urological Association actually says that men who have a PSA between 4.0 and 5.0 should undergo what is called risk stratification. The other is through a test called a phi test, and this is a test where we check your urine for the presence of prostate-specific antigen in the urine. If there's a lot of it there, it could suggest that you might have some sort of issue with your prostate. And lastly, we do a test called the 4K score. This is a blood test that looks for other biomarkers that may be present if you have prostate cancer, and that means that we want to figure out what your risk of having cancer is. A PSA, or a prostate-specific antigen, is a screening tool that we use to help identify men who might have prostate cancer. About 80% of the time, a PSA of 4.0 will be a false alarm. However, you do need to follow up with your doctor and go through the appropriate workup to make sure that you do not have prostate cancer. So in men between the ages of 50 and 59, about 11% of men will have a PSA over 4.0, but otherwise, most of the time if they're normal, I'll probably just watch and wait and repeat your PSA every 6 months to make sure S is not going up. And between the ages of 70 and 79, about 30% of men will have a PSA over 4.0. So already you can see that as you age, your PSA can increase, but it doesn't necessarily mean that you're developing cancer. It's a blood test that's very easy to draw. You just have to have an empty bladder and that's it. No special preparation needed. Now, the way that PSAs work is that if you have a low risk of having prostate cancer, your PSA should be less than 2.5. And so when you get over that number, we say, hey, maybe there could be something wrong. And then between 2.6 and 5, we call this the gray zone or the equivocal zone. And above 5, we say, hey, definitely something could be wrong. However, it's important to remember that a PSA is a screening tool only. It's not a diagnostic test. So, how many men have a PSA over 4.0? Well, depending on age, it can vary. Other factors that can increase your PSA include having an enlarged prostate, having prostatitis or infection of the prostate, having recently had a procedure such as a biopsy or catheterization, being impotent, or having issues with ejaculation. And lastly, having a family history of prostate cancer. If your PSA is between 4.0 and 5.0, what should you expect at your follow-up visit? And there are several ways we do this. One is through a digital rectal exam or DRE. If any of those tests are abnormal, then we may proceed with a biopsy. So bottom line, should you be worried if your PSA is 4.0? The answer is no. As always, I hope you enjoyed this video. And remember to take care of yourself because you're worth it.